So the next one is the just the supine exercises. So this would be active range of motion, or if active resistive if you have any weights or anything like that. But normally we just have the patient do active range of motion exercises. We'll just demonstrate on one leg pretty much. Okay. What I have patients do is a quad set. Normally with our total joints, or we'll have them do a quad set. That's tightening the thigh, pushing the back of their knee down. What I normally do is put my hand under there, under the knee, so I can feel it. You can feel if they're putting out any effort. Also, I also will kind of pull up a little bit so they can kind of get a feeling of what they're supposed to do, because it is difficult to teach. So I try to teach, okay, push down in my hand, push down in my hand, and I'm pulling up and resisting her so she can feel what that's like, okay? You can watch the quad, make sure they're actually participating, that they're doing it, that they're kind of getting it. You can tell if they're not even trying by looking at the quad or any kind of twitch. You can't feel anything in the back, okay? The gluteal sets, also usually we do with the hips and total joints. What is where they're going to squeeze their gluteals together. Okay, I usually have them hold it for a count of 5 and then relax it. Same thing with the quad set. Hold it for a count of 5 and relax. Okay, squeeze again. Sometimes you can check, you can feel here on the patient, or you can visualize if they're actually participating and doing it. Relax. Okay.
Oh yeah.
The next one I have people do is the heel slide. What they're going to do is slide their heel on the bed, up and down, and they're doing the hip flexion, extension, knee flexion, extension. Okay. All right, and then this next one, have them go out to the side, keep their knee straight, out to the side and in. Okay. And you do that for as many repetitions as the therapist has instructed you to do. Okay. Usually I'll go up to 20. Okay. You can have them actively. What I'll tell them to do is try to touch your toes together and go out. Touch your toes together. And sometimes you have to kind of get their knees apart a little bit just to have them put a little bit more effort into the internal rotation, and then out. Okay. Ankle pumps. What's that? Up and down. Okay. Have them do those. Okay, that's good. The next one is what we'll do is a straight leg raise, and normally I will have them bend your knee, bend the opposite knee that you're working on, because what that does is that flattens out the low back. If you have both your legs straightened out like this and they're flat and they try to lift, it puts a lot of strain on the low back. So make sure at least one knee is bent. Can you tell how that flattens out? Okay. Have them tighten up their thigh, keep their knee as straight as they can, and lift. Usually I'll have them lift even with their other thigh. If they can't, I at least try to get them worked up to that and down. Have them do it nice and slow, not bouncing off the bed, okay? Which some of them like to just start bouncing, okay? And you'll do that. Nice and controlled. All right, that's good. What I'll do is either roll up pillows, blankets, whatever I can find, to get about a 8 to 10 inch circle, and I'll stick it up under their knee. Okay. What this does is it works the last few degrees of knee extension, which is where most people lose, they're the weakest. Okay. So what I'll do is I stick that under there. Sometimes if it's not big enough, I'll stick my arm under there and make it a little higher. Then I have them kick straight up, hold it at the top for a couple seconds, and then let it down easy. And kick up and down. Okay. Now, if they can't, this is usually one of the more difficult ones sometimes, especially after knee replacements. If they can't get it all the way up, I have them try, lift it up, or I'll assist them all the way to the end, tell them to hold it, and try to do an eccentric contraction and let it down easy. Sometimes they can't, but that if they can't do a concentric or lifting it up, sometimes if you start with do an eccentric contraction, so start up here, have them tighten up, and then try to lower it down, control, it'll kick the muscle into working. And then usually after that, they can start doing a few more on their own. Okay? Up and down. There you go. And down. Okay. All right. That's the short arc quad. All right. And one other one that's sometimes used, the therapist will have you do a bridge with a patient. Usually, sometimes with strokes or general medical people will do that. Bend both your knees, okay? And you're basically making a bridge, okay? I want you to lift your rear end up off the bed and then back down, okay? Sometimes I'll kind of assist if they need it. I'll kind of pull and kind of give them up, or I will tap the gluteal muscles and try to get them to kick them in a little bit more, up and down, up and down. And most of our little people won't be able to lift it as high as you're doing, but that's good. Sometimes you have to go down. Sometimes you may have to help lift them a little bit, assist them on the active assistive stuff, and help them lift their rear end for the bridge.